You're listening to Bodywise. I'm Matt and I'm a GP.
I'm Ciara and I'm a practice nurse.
And Ciara, what's Bodywise all about?
Bodywise is you and me chatting about primary care, about what's going on in the world of GP, general practice.
And what we're hoping to do is to kind of demystify a lot of topics in healthcare. So maybe stuff that people think about but don't want to talk about, or stuff that they might have wanted to bring up with their doctor or nurse but are maybe too shy about, and things they might think might be a stupid question. So
yes,
the aim is to go for topics that might be a little bit out there, a little bit unusual, and to get the conversation going.
Exactly. And we've got some busy people with busy lives. Some people haven't made that space to have that conversation that they need to have, and maybe this will be the nudge that they need. They learn a little bit and they think, do you know what, that's kind of what I've been feeling, or it rings some bells, and maybe that'll give you the push that you need to go and see your GP or your practice nurse or the right person for you. Because there's so many changes, isn't there? It's that the traditional setup in GP land has changed a bit, and you're going to see some other healthcare professionals, not just your GP, and you're going to interact with healthcare professionals not always in the same format, so things can look different, right? And
we're going to talk about what happens in your lives as well, whether that's low mood, dry vaginas, erectile dysfunctions. We're going to try to cover all the topics, whether it's male or female, old and young, and that's the key.
So if people have got a question about their health, or a question about a loved one's health,
or a topic they'd like covered, no matter how crazy, stupid or absolutely insane that might be, it will be, drop us a line at
bodywise@manxradio.com.
So this evening we're going to talk about general practice and what goes on in general practice. So if you ever wondered what happens behind the GP's door, what the GPs and nurses get up to, and what they talk about when the patients aren't listening, tonight is your night.
Fascinating stuff. So Matt and I work in the north of the island, and we work in primary care. Matt, explain it for me. What does primary care mean?
Primary care basically is care in the community. So basically care that happens outside of the hospital is basically primary care. So your primary care team is your GP and your practice nurse, but also there's a whole army of people out there that make up the primary care team. District nurses, community mental health nurses, and a whole team of people out there. So basically anyone that doesn't work in the hospital, you can kind of consider them as being primary care or community care.
And we've got extra people now, haven't we? If you come into our practice, you can see a whole bunch of different faces now. We've got advanced nurse practitioners, we've got a paramedic, we've got a pharmacist technician.
We've got a pharmacy tech, yeah.
Pharmacy tech.
I think one of the big things that we wanted to get across was, it was traditionally when you were sick you went to see your GP or your family doctor. That's changing, and actually sometimes, a lot of the time, the person you need to see probably isn't your GP. It's somebody within your GP practice but might not be the GP themselves. So for example, our paramedic Adam is excellent at minor injuries and acute illnesses because that's what he trained in.
Yeah, we're trying to make sure that we signpost people to the right professional straight away, rather than everything going through a GP and then being streamed off.
And that conversation starts with the medical secretary, who I think are the unsung heroes of healthcare.
Yes.
Do all the work and get none of the thanks, I think. So that's why when I was saying to patients, you're going to have more conversations with your medical secretaries, who are maybe going to direct you towards the paramedic, maybe going to direct you towards Ciara. You might want to speak to me, but actually Ciara might be the best person for you to speak to. And the secretaries are basically the guardian angels. They look after you, but they'll direct you towards the best person to see, because often it might take a few days to see myself or Ciara, but actually you might be able to see the paramedic or the pharmacy tech on the same day, and ultimately we're all working together as part of a team anyway. So that's the single most important message. So Ciara, you took a little trip around the Ramsay Group practice and spoke to some of our newest members of staff today, didn't you?
I did. I went around. There's something happens when you pull out a microphone and point it in someone's face and say, tell me more. Lisa, you're one of our newest team members. What do you do?
I am a practice pharmacy technician, and the role involves basically a lot of meds management and nursing home management for cycles and medication issues, medication reviews. I also do a lot of the pre-dated scripts, managing compliance for patients in regards to medication, overuse, underuse, helping the patient understand what the medication is for, how they use it, how they should be using it, whether they understand what it's used to treat and how often they should be taking it, the benefits, the risks, basically anything that they need to talk to me about as regards to medication.
So by having you here, that means that we're going to do a better job at making sure that people have got the right medicine and that they know what it's for, and that we've made the changes that we need to make. Is that right? Have I got that right?
Yes, that's right. So there's also correspondence that come from nobles and consultants. So new medication that started. It helps. I can be a useful tool to help them understand what the medication is, the side effects of the medication, how it could possibly interact with other medication that they're on. That doesn't necessarily get seen by the consultants. They tend to just concentrate on their speciality and their medication and not the medication for the patient as a whole.
I get it, right? So like if you've gone to see your cardiologist and their main concern is your heart and they've given you some heart meds, it might be that you'll be looking at what about all the other medication that you're on for the other parts of your body, because the cardiologist problem is your heart and that's what they're concentrating on. So your job is looking at everything else in that package and making sure. Yeah, right, brilliant. How's it going?
Fantastic, absolutely fantastic. It's nice to delve in and discuss medication with patients. It's a lot of patients, they don't really a lot of them don't really understand what the medication is for, and it can be a little bit apprehensive, to be fair, to ask the GP or question the GP. Whereas a pharmacy technician or a pharmacist, they don't view as superior, kind of a thing. So it's like their own level, and they'll say, well, yeah, the doctor said that, but I don't know what he meant.
Right, so they feel like they can approach you more to have that conversation, learn a little bit more about what they're having.
Yes, and they open up a lot more, to be fair. You tend to get more out of them. They say, oh, they didn't mention that and I didn't like to say. I hear that quite a lot.
Does every GP surgery have a pharmacy tech?
No, this surgery is the only one on Ireland. I am the first.
Wow. Do you think it's something then that'll probably roll out, or?
So I obviously come from the UK. I've got a UK background. I've been a hospital technician. I've covered pretty much every area of pharmacy that you can cover. So industry, clinical trials, hospital, community, and across it is kind of rolled in with all of what used to be the PCTs, and they have standard pharmacists and technicians in most of the practices now. Pharmacists do a lot of clinics, technicians do a lot of the background work and legwork. When you come to hospital discharges across, it's pharmacy is the last point of call. So your pharmacy technician and your pharmacist is the last point of call before you're discharged from hospital, to make sure that your meds have had a proper thorough review.
I love that we can, as a team member, could come to you with the most obscure questions about medicines and be like, I'm not totally sure, do we still use this? Do we use an alternative? What's the best thing? And you've just always got the answer on your tip of your tongue. So how do you stay so up to date?
So the role of pharmacy technician has developed quite a lot over the years. Most significant and poignant part was the Carter report in regards to technicians, where they recognised and utilised not only, we go through a lot of training. We're not as clinically based up to a degree, but we still have to, keep on top of our continual professional development. We're answerable to the pharmaceutical board. We have to pay a registration fee in order for that and prove our competence year in, year out. So we have to stay on top of these, any new medications that are coming out, because as you know, medicine changes every single day. They're bringing out new drugs, and that was my interest within the clinical trials part of it as well. I've done a couple of years in clinical trials, and it's to see how a medication goes from literally being a couple of letters and a number to something that you see on the shelf, in 5 years' time.
Is there anything that you've seen coming from the UK that you wish that we could implement here that you think would bring about a positive change?
Oh, yeah, several. So I would say, coming from the UK, electronic prescribing would be absolutely fantastic.
Yeah.
Also, do we have in the UK is what they call a summary care record, which is accessible to basically anyone in a healthcare profession. Hospital wards, pharmacies, community pharmacies, hospital pharmacies, and it's all linked together via a smart card. It's personalised to that patient. It's all data controlled and protected. You have security with a PIN.
So is it like a kind of how-to guide for each individual patient?
It's kind of like an open window. So you put your smart card in, and you can literally see everything that patient has had, whether it be private, whether it come from pharmacy, whether it come from hospital. It's all integrated into the same place. It gives you a clearer picture of what the patient has taken. Patients don't tend to class a lot of things as medication, like doing medication reviews and stuff at the side of someone's bedside. It's, what medication do you take? And you go through about 5-6 tablets. Is that it? Yeah, okay. What about your cream? Oh, yeah, I forgot about that. What about your patch? Oh, yeah, I forgot about that. Do you have any injections? Oh, yeah, I have one of them once every 3 months. They don't think of them as medications because they're not oral tablets, but they are. And even over-the-counter medications, herbal medications, herbal preparations, people don't consider them.
Is there anything that you've seen on the island that you've never seen before in other places that you've worked that you find fascinating or that impresses you?
Yeah, the hospital, actually. Noble's Hospital is actually a fantastic building, and it's got some state-of-the-art equipment. It's lovely, coming from the Royal, which is literally falling down around you, I suppose. I do feel as though it'd be fantastic. It would be, if it was utilised to its full potential, I would say.
Yeah, I feel very grateful for how beautiful our building is and how lovely and wide our corridors are and how clean things are,
It's not unusual when it rains in Liverpool to see a couple of totes collecting the rain in the corridors.
Thanks so much for talking to us, Lisa. I really do see the impact that you're having here and just how much quality you bring into the team. And I know that whenever I talk to the other team members, they're always like, have you asked Lisa? She knows everything. So I think it's really exciting that we've got you here, and we've got the first pharmacy tech on the island. So hopefully people will follow suit. Thanks.
Love. Thank you very much.
Mandy is our practice manager up in Ramsey, and she's very much the glue that holds this whole team together. What do you love most about your job?
Oh, it's too much. It's a bit cliche, but it's definitely the patients. I do love the patients, and I've got to know them over the years. I love them all. It doesn't matter who you are, what you are. I will give you as much time as I give everybody. So I treat everybody the same. The worst bit about my job, I'm going to tell you, the worst bit about my job right now is abuse from the patients. And on a daily basis, one of the staff will go home crying. I was brought to tears last week by a patient that was shouting at me. This week I've been called a really unpleasant word, begin with C, ends in a T, through no fault of my own. Somebody's sick note had run out and they'd forgot to remind themselves to order it, and then I got blamed for not feeding the children and things. Yeah, every day one of us will be blamed. If I die, it's your fault. I just want to give a big shout out to the admin team because they have an awful time.
Do you know what? They're amazing, actually, because I've been trying to catch them for weeks to say, tell me a bit about what people say to you. And they don't want to whine about what people have said to them, and they don't want to linger on it. So
no, they don't. And on average, probably most of us will take... It's got to be between 150 and 200 calls each a day. We can't fit 200 people into slots. That's a lot of phone calls. So we do a lot of helping them ourselves if we can, signposting them. It could be prescription queries that we can deal with. So we are really busy, and that is on top of working, most of us, 7 days a week, printing at least 500 prescriptions a day, scanning all clinic letters because they still come by little bits of paper, not electronically. That's all got to be scanned into patients' notes. And then on top of that, we don't have any tea breaks. We have a really small dinner break, but we just crack on with it. During the first lockdown, they ring up. They spoke to a GP immediately. They got the prescription immediately because services were really at a halt, weren't they? So we could get onto things really quickly. But now a GP wrote a news article in the UK, and they said that COVID has produced the Amazon Prime patient.
Yeah.
Because they were used to sitting at home, clicking a button. Their delivery came, their groceries came, their prescriptions came, their film came, their shopping came, their clothes shopping came, and that's how they view services now. I think they think it's got to be immediate, and we can't sustain that.
It's funny, isn't it? Because there was that bit at the beginning where we got a lovely clap, but it was nice, and there was something a bit emotional. I remember seeing people come out of their homes to clap for us all, and it was quite emotional actually, because I think when there was a lot of fear and a lot of uncertainty about how things were going to go.
Yeah, people were scared.
So since I started here, we've changed our doctor's appointments so that instead of having 10-minute slots, quick fire slots, we've got 15-minute slots. So that probably means we've got a few less slots, right? But the quality's changed. What do you think to that change in slots, and what made you decide to do it?
When I first started, the slots were 5 minutes. They used to do phone calls, but the appointment slots were 5 minutes. Then we made a drastic step to do 7.5-minute appointments. But people now tend to save up problems. So rather than just coming in with one, they're coming in with lots. So we moved it to 15 minutes so we don't have to say, sorry, run out of time. So I think it's better. And it's like we've moved over to triage. A lot of people don't like it, but a lot of people do like it. And I think a lot of people actually can be dealt with over the phone, and a lot of people do like that. If GP thinks they can't deal with it over the phone, they'll pull them in for an appointment themselves.
And also we've got more team members, right? So you're not just going to see a doctor's face now, you could see a whole bunch of different people's faces depending on what you need. So actually it's like you've got staff tailored to the needs of a wide variety of patients, right? How does that change the job of all the admin team and like front of house work for making sure that make sure that patients see the right person?
At the moment it's a bit of a struggle because people only want to see their GP. People will wait weeks only to see their GP and then complain that they can't see their GP, they've waited too long. We're trying to call people clinicians rather than advanced nurse practitioner, nurse, GP, paramedic. You're going to see a clinician, because if you say you're going to see a nurse, for some strange reason people won't wait for a nurse.
How rude.
To be immediate. I know it is rude. We've got the statistics that people complain more if a nurse is running late. They complain more about a nurse running late than sitting waiting 45 minutes to see their GP. But interestingly, those people that complain that they've sat waiting will then come in and keep the next person waiting.
Yeah.
So, they're not happy to sit and wait, but they're happy to make others wait.
Robert is one of our reception team. Thanks so much, Robert, for having a chat with me. Tell me a bit about your job.
One of my main jobs is sending out the texts to remind people of their appointments. Since we've brought this system in, there have been less people not attending appointments, and I think it's a good thing. So those people who've got very busy, active lives, it's just a courtesy to remind them.
That's ace, actually, isn't it? So it means that we've got more appointment slots available because we're not having so much wastage, right?
No, absolutely right. And there is also a way of where you can actually emails if you can't attend the appointment. Again, you can generally ring as well. But I just find that sending an email, it's quick and it's easy for those people.
How long have you worked at the practice?
Been there for 5 years now. 5 years, and in that time, a lot has changed.
What's the hardest thing about being in the reception team?
there's lots of aspects. All of us really find it not difficult as such, but it is trying to keep everybody happy. There's obviously, once the phone calls have gone, people maybe do get a little bit uppity, and some people can be rude. But at the end of the day, we can only do as much as we can do. We do have a system now where we can pre-book a phone call for those people if they're happy to have a pre-bookable phone call with one of the doctors, where then they don't have to ring in the morning. But we always say that if you feel that your inquiry is urgent and that you feel that you need to speak to the doctor on the day, then you obviously call on that morning, where if it's not urgent, as I said, we can pre-book telephone calls where the doctor will ring you a few days later.
Do the telephones ever stop ringing all day?
No, the phones are continuously ringing all day. They open at 8 o'clock and they don't stop ringing until about 6 o'clock. Now, there are people who think that we don't answer the phone, but what I say to people when I see them face to face is the amount of people who are now on the island has changed immensely, and there are more people in Ramsey, and we just don't cover Ramsey, we cover right up to near the end of Kirkmichael. So if people can imagine everybody ringing in at 8 o'clock, we've got Ramsey, Derby, Andreas, Bride, Sorby, everywhere right up to the end of Kirkmichael, and we as a team try and answer as many calls as we can. And quite recently we've just had a new phone system put into group practice as well.
So we can get like 600 calls a minute, can't we, in that peak time? And how many people are answering the phones?
Altogether, on a Monday, we will have about 15 members of staff, and they are continuously answering the phone from 8 till about 10. That is our kind of high volume, busiest time, if you like.
If you could swap places with anyone in the practice for one day, swap jobs with anyone in the practice for one day, who would you swap jobs with?
I wouldn't. I think I'm quite happy in what I'm doing. I wouldn't want to be one of the nurses. I wouldn't want to be one of the doctors because I'm very squeamish. So I wouldn't want to see any lumps or bumps. Thank you very much.
Thanks, Robert. Who would you swap places with, jobs-wise, in our surgery for a day?
Andy, the practice nurse.
Why?
Because I think it'd be really interesting to see what life would be like from his perspective, and I think it would be interesting to see what life would be like from his perspective as a male nurse.
Oh, very good.
Who would you swap?
Nobody. Everyone's got a harder job than me. I sit and watch sometimes and I think, I'm so glad you're here, to everyone else in the team. Maybe Ciara, the cleaner, because I feel like Ciara knows what's going on everywhere, you know, and I'm kind of nosy, so I'd quite like to know what's going on in every room. And also, she's just got that authority, you know, she tells me off all the time because I'm quite messy. She leaves me little notes sometimes.
I think I'd find being a practice secretary too difficult.
I'd cry within half an hour, break.
We get 600 calls a day in Ramsey, and that's handled by a team of 6 admin staff.
Yeah.
It's pretty much 100 calls a day. Yeah. I don't know how they're not collapsed by the end of it.
So much pressure, like making sure that you can very quickly file people into the right appointment slot that they need, answer the next call because people's phone call is ringing and ringing. Like, that is a lot of pressure, isn't it? And those calls are, like you said, 600 calls, but they're all coming in at the same kind of time. Yeah, that's a tough job. So
when people say to you, and I'm just going to put this to Ciara because Ciara used to work in the emergency department, who are the arch enemies of general practitioners, you guys do nothing in GP. What do you say to your friends in the emergency department now when they say that to you?
When I went to work in general practice, a young nurse said to me, "I'm so disappointed." She said, "I always thought you were so cool. I used to see you running around the hospital working for Air Ambulance, and you were always so busy, and you had all your kit, and you were going from here to there to here to there, and you come down the emergency department and you come up to CCU, and now you're going to go and work in general practice. I laugh my head off because I've never been so challenged as I've been now with the diversity, but also the grey area. You know, when you're working within the hospital, you've got this, you're always within a team, and you've always got those people to bounce off, really. You bounce your ideas off each other all the time. You've got that backup, and you can order whatever test you need instantly, right? So when you're working in general practice, there's a lot of solo work. You've got a great team that you can call on if you need them, but you've got your own list and your own responsibility, and you're never quite sure what's going to come in through that door. And there's a lot of grey area of waiting and making sure that you're going on the right path for that individual, and things move at a different pace. You know, it's such a hard job, but I love it. I think it's cool. We're making it cool. I've got green hair. That's cool.
Yeah, well, GPs, the reason not GPs are the most useful doctors. So basically they know a bit about everything, not a huge amount about small numbers of things, but they know a little about everything, and they're basically the most useful doctors, I think, obviously being super biased.
I think you should rebrand yourselves to like
super doctors. I like that.
I was going to say like consultants in primary care, but whatever.
So the term we use in Ireland is specialist in life, which I love.
Right. It's like an agony aunt though, isn't it?
No, but I mean, you know, as you know, our day would be super varied. So to go from a teenager who's having a mental health crisis to an older man who's worried about his prostate to, you know, somebody having chest pain, it's hugely varied. Yeah. So there's never a boring day in general practice, is there?
No.
What would you say if I was to say to you, Ciara, your top tips to make your GP consultation or your visit with a practice nurse as efficient as possible?
Oh, that's a very good question. You know, you've got 15 minutes, haven't you? And you've always got that little bit of time. Like, arrive on time. Don't eat into your consultation. You've just wasted half of it already. So arrive timely and sit and gather your thoughts. That's my top tip. And be realistic about what you're going in with. And you go in with a problem, you need to explain it. Your clinician needs to hear it. They need to document it. They need to examine you. They need to look at your history. They need to look at your current medication. Like, that's quite a lot already to pack into 15 minutes. Then they need to come up with a plan, discuss it with you, give you a prescription or not. And go forward. And that's a lot to fit into 15 minutes, or in some practices it's 10 minutes, isn't it? We're very lucky we've decided to make our slots 15 minutes, and I think that really adds a lot of value. But don't come in with 8 different problems, because probably that's not realistic.
No, I mean, your GP nurse will be there tomorrow, next week and the week after, and basically pick 1 or 2 of the things that are most pressing for you, and we'll sort that out for you. So I think that's fair enough. What I would say is just put a bit of thought into it. So again, when you go into a barber, you kind of think about whether you want a fade or whether you want, you know, something else done. A lot of people go into the GP and have put no thought into it whatsoever. So just put a bit of thought of what you want out of it. Because if you know what you want out of it, it just makes our lives a little bit easier.
That's very true. Yeah.
So the GP might not be the person that you always need to see. It might be the practice nurse, it might be the paramedic, and it might be the pharmacy tech. So just put your trust in us to guide you. That would be the take-home message from me.
Exactly. And be nice to those receptionists.
Treat your receptionist like you treat your barber.
Exactly.
So that was the end of our first episode of Bodywise. Ciara, what is coming up in the next few weeks?
Menopause, my favourite topic that I never stop talking about. We've got teen health, important one for both of us, I know. We've got addiction, something I know you really wanted to talk about, and dementia and depression. So if those are topics that you've got questions about that you would like answering, please get in touch and we'll try and answer some of your questions.
What we're going to try to do is get an expert in each week, so an expert in their relevant fields. So next week we're going to have an expert in the menopause.
Yes.
So if you have questions on any of the topics that Ciara has just discussed, you can send them in to bodywise@manxradio.com, and what we'll aim to do each week is to cover the most pertinent topics of what was discussed, and then have a huge amount more information to listen to on the podcast, which would be on manxradio.com. So thanks for listening to Bodywise. I'm Matt.
I'm Ciara.
And it's been great having you.
Him too.
Until next week.